I say bring them all home. Ireland, for such a rich country as they keep telling us we are, has a health service, a public health service, that is constantly in crisis. If you've ever had to interact with the public health service here, then you will know it's like something from the Congo circa 1956. And the recent scandal with Harvey Morrison Sherrod, the scoliosis scandal, and there's many other kids in his position. Sadly, Harvey passed away. It's just a small indicator of how dysfunctional the whole situation, the whole system is. The HSE is badly run, it's bloated, it's got terrible leadership, and the staff are unmotivated because there's constant overcrowding, there's constant queuing, and there's constant ever-expanding waiting lists for even basic operations. If you are very young, if you're very old in Ireland, forget it. You're just an afterthought. If you're somewhere in the middle, well, you can just get in there and queue and hope you don't die before you get the treatment you need. Now, we're told again constantly that the service that we do have, the health service that we do have, would not exist, could not run, could not function if it were not for an influx of foreign staff, people from all over the globe, many poorer parts of the globe. And I fully admit that there is definitely a need for foreign staff to an extent. But my point today is simply this. We have a large number, tens of thousands, of highly trained, highly motivated Irish men and women who have moved abroad to various parts of the world, medical professionals who would dearly love the chance to move back home to Ireland and to work here in Ireland, to have a family here in Ireland, or bring their family to Ireland, raise their kids here. And the government is doing absolutely nothing to help that situation. They're ignoring it. They've got scouts and agents all over the Philippines, all over the continent of Africa, all over the Indian subcontinent, trying to hoover in staff for their hospitals, the clinics, old folks' homes, all that kind of thing. And far too many of them, and this is a story that pops up regularly, even if the mainstream media tries to kill it, far too many of them have bogus degrees, have bogus medical certificates, and have bogus CVs and experience. It's estimated over 83% of all malpractice claims are with foreign staff. And some countries like Pakistan, like Nigeria, the level of corruption in universities, the level of corruption in terms of getting accreditation is off the charts. And I know this, I've been lucky to travel throughout my life in various parts of the world, and there are parts of the world where you can quite literally buy anything. Anything. Driver's license, no problem. If you've got the money, you can buy it. You want to be a PhD in, biology? Yeah, if you've got enough money and the connections, yeah, you can get it. No problem. You don't have to do the work. And that's a big problem. And another problem with this situation is that when they're trying to check the credentials, that's often a problem. Who do you call? Who do you speak to? Often I'd say, the places that they're supposedly got all these accreditations from, people don't speak English there, or they're not very cooperative there. Anyway, the problem we have here, as I see it, is there's far too much reliance on this easy, quick, cheap fix of just hoovering in people from certain parts of the world, when we have a diaspora of Irish people who would dearly love the chance to come back to these shores and give their fullest efforts in the cause of Ireland and the Irish people. And the government isn't facilitating this. I would suggest it could be because certain agencies are doing very well out of the recruitment situation in Africa and India, Pakistan, and all these other places. They're getting paid handsomely to hoover in these people, and maybe there's just not enough money in incentivizing Irish people to come home. And if you have any doubt in your mind that there are many, many Irish health professionals abroad who'd love to come back to Ireland and work here in Ireland, well, check out these little photographs I found. Here's one from Melbourne in Australia. Give us a reason to come home. Or as far away as Doha in Qatar. Or how about Sydney, also in Australia? Closer to home, London. Back over to Arabia with Saudi Arabia. And last but not least, Perth, also in Australia. And the message to the Irish government is crystal clear in each of these photographs. Give us a reason to come home. Now, they were asked to come home during the pandemic, and some of them did, and they immediately got shafted. They got the cold shoulder, having been invited and asked to come home and help out the home country, the mother country. The government then just completely ignored them, and most of them just went back to whence they came because they weren't really wanted. And here's one quick example of an Irish woman who has been away for 10 years, spent 10 years in New Zealand. She's a psychologist, a highly qualified, highly trained medical practitioner, and 10 years experience at least working for the New Zealand government. So she's obviously at the top of her game. She came back to Ireland. She actually got on a plane, flew the whole way across the world back to Ireland, to a health service that's supposedly crying out for staff, for highly trained, for highly motivated staff. Well, here's how all that went.
Story time, moving back to Ireland. I've done 3 months. Haven't been able to find a job, accommodation, or like car insurance is even affordable. After 10 years working in government in New Zealand, so my savings are decimated and I haven't been spending much. Like I've bought nothing here. I do nothing. I go nowhere. But it's just not. It's no country for old women. So I just bought my ticket back to New Zealand, where I'll have to start over again, find a new job. But at least I have some hope of that happening there.
I was immediately struck, apart from the craziness of the situation, but what she said there, it's no country for old women. Well, first of all, you're not an old woman. If you want to know what old is, try being me for a day. But the truth, as far as I'm concerned, is very fast becoming, and more people are realising this, Ireland is no country for the Irish. Our government, as usual, has everything back to front and upside down. No surprise there, that's what you're thinking, because you're right to think it. They are scouring the world, they're scouring the poorer parts of the world, the more underdeveloped parts of the world for medical staff. And I'm not saying we don't need a certain number of those. I'm not saying that. That would be naive. But what I'm saying is they are prioritising that. They are pumping money into agencies to go find them and get them here. And that entails also a lot of family reunification. So it brings its own problems too, because guess what? They all need hospitals and healthcare too. But they're not in any way, shape or form doing anything for our own highly trained, highly motivated medical staff who at the moment are abroad and are begging the Irish government to give them a reason, give them some incentives to bring their skills back to Ireland and the Irish people. They want to. They're begging to come home. But there's nothing here for them. The government will throw money hand over fist at Ukrainian people, at people from Gaza, at people from Africa, at people who romp in without even a passport on their person. They will pump money into their welfare and their well-being. But the people we are told we so desperately need, medical staff, to populate, to staff our crumbling, our dysfunctional health service, our public health service, crickets. Crickets. And even the few that make the big decision, as you've seen there, to come home, it's nothing for them. They can't get a job, can't get accommodation, they can't even get car insurance. Why would they come home? Well, they wouldn't, and they can't. And I think that's wrong. And that's squarely on the Irish government. They could make it happen, but as we saw in the Harvey Morrison Sherrod, tragic case. What they could do, they won't. They won't bother. And I say this has to change. Ireland needs Irish people to come home, the diaspora. We should be absolutely doing everything we can to entice them and to invite them and to make them welcome and give them all the support we possibly can. I say, do it. Bring them home.